Hi, everybody. Welcome to GW Center for Integrative Medicine. I'm Dr. Kogan, Chief Medical Officer, Associate Professor here at GW, where I'm actually making this recording. So I want to give you a quick overview of what methylation is and also this new partnership. We're partnering with Autonomous.Health. It's a AI-based startup that's beginning to develop a variety of different protocols that are supporting patients' care. And the first protocol that Autonomous is developing is methylation. So you all have an opportunity to have a free assessment and also a free recommendation. And of course, if you recommended supplements, you will have to buy them, but it's a fully automated process that includes taking your personal information as to how good or not so good your methylation is. It includes history taking and asking you about some tests and even some genetic information. So what is methylation? Methylation is a really important function of the body. It is a process by which we take a methyl group, CH3, and attaching it to a variety of different molecules. Methylation activates hundreds of different processes in the body. I'm just going to mention some of the most important ones. Detoxification is heavily depends on methylation. In fact, methylation is one of the phases of the detoxification in the phase 2 that happens mostly in the liver. Methylation is one of the key aspects of it. Methylation requires to activate and create neurotransmitters, including things like serotonin, norepinephrine, dopamine, and others. Methylation is also critical in making sure that we have an active forms of some vitamins, particularly folate and B12. In fact, the treatment of inefficient or ineffective methylation involves very commonly taking an activated forms of B12 and folate, sometimes with food. More likely than not, it's actually a supplement because it's easier to do it and the dose is much more regulated, much more regimented. Methylation can be assessed through a variety of means. You can learn about your methylation or your capacity to methylate first by genetic tests. Common tests called MTHFR, but that's not the only one. There are many others. And also by checking things like homocysteine, B12, and folate level, and even doing a more complex methylation panel through tests like Genova, where you can actually assess, in addition, things like SAMe level, SAH, and others. So methylation, in short, is a complex process. Our body uses methyl groups for a variety of different enzymatic activity. It's critical to our function. In fact, severe methylation defects are not compatible with life. But why we're talking about this, about 40% of all Americans actually have a mutation in MTHFR gene, which basically makes methylation less effective. Not the end of the world, easy to treat, some B complex or maybe specialized methylation support. Some of you may be taking product called homocysteine supreme or methylguard. So those are some of the common ones we're using. So I encourage you all to take this opportunity if you're interested. Signed up with Autonomous. The process should take somewhere between 30 to 60 minutes to do a full assessment online. It's cost you nothing, at least for now. In the future, we don't know how Autonomous will be becoming self-sustainable. We do think that there could be a variety of ways that money can be made here for the company. But for now, this is a pilot. You get all of the processes for free. If you do need to do tests, there will be a specific process for you to get the test from Rupa. We can also potentially organize additional tests for you through the Center for Integrative Medicine. If you have insurance, we can try to run it through insurance. Now, I'll leave this video open to everybody, not just to our patients, but I'm recording it primarily for patients at Center for Integrative Medicine. But if you're not our patient and you're interested in learning more about this or joining our clinic, gwcim.com, I'll make sure that the link is in descriptions to the video. I hope everybody doing well, staying cool. It's really hot. I'm in DC, 95 degrees outside. And yeah, actually, good methylation helps it to control the temperature. That's one of many, many requirements or one of the many, many functions that methylation engages in. All the best to you. See you soon. Goodbye.